My name is Molly Jackson, and I am an RN at Care Express. I'm calling about a patient named Joe Smith. He is a 72-year-old male. We will be transferring to your center due to critical care. Joe presented to the clinic today with report of chest pain and shortness of breath. He rates his pain at a numeric value of 7 out of 10. Chest pain began while shoveling snow from his driveway. The patient has a history of diabetes type 2. He takes metformin 850 milligrams once daily with breakfast and a multivitamin once daily. He does not have cardiac history and no known drug allergies. He is alert and oriented ×4. No change observed in level of consciousness. The patient is pale and diaphoretic. No peripheral edema is noted. Mucous membranes are pink and moist. Glucose value of 120. Blood pressure is 160/90. Heart rate is 100. Pulse oximetry is 98 on 2 liters of oxygen via nasal cannula. Respirations are 20 and labored. Lung sounds are clear bilaterally. Patient does report feeling anxious. EKG showed sinus rhythm with possible inferior infarct. Patient has an elevated troponin value of 0.52. Patient has an 18 gauge in his left AC. Patient received nitroglycerin 400 micrograms sublingual ×3. Patient did not have relief. Aspirin 325 milligrams administered and morphine 2 milligrams administered. Our physician has recommended that he be transferred to your facility for cardiac evaluation. Do you have any questions? Do you have any recommendations while we await transport from EMS? No recommendations? Thank you. If you have any questions or concerns, please give me a call at 304-709-4163. Thanks. My name is Molly Jackson, a registered nurse at Care Express. I am calling to give a report on a patient, Joe Smith. He is a 72-year-old male with complaints of chest pain and shortness of breath. He was admitted for possible heart attack. He has no cardiac history. He is a type 2 diabetic. He takes metformin 850 milligrams and a multivitamin once daily. He has no known drug allergies. His treatment has included nitroglycerin 400 micrograms ×3 doses with no reported relief. He received morphine 2 milligrams, aspirin 325 milligrams, and is receiving oxygen at 2 liters a minute via nasal cannula. His last EKG shows sinus rhythm with possible inferior infarct. He also has elevated troponin levels of 0.52. Patient has an 18 gauge in his left AC. Our physician has recommended that he be transferred to your facility for cardiac evaluation. Do you have any questions? Do you have any recommendations while we await transport from EMS? No recommendations, thank you. If you have any questions or concerns, my name is Molly Jackson, and I can be reached at 304-709-4163. Thank you.